Samuel. Samuel is a research analyst at the Happier Lives Institute and is passionate about empirical solutions for positive impacts in the world. He holds a master's in cognitive decision sciences from UCL. His work often requires him to apply knowledge about human thinking, about statistical skills to measure how programs affect subjective well-being. As a Christian, he is particularly interested in this topic of how best to promote well-being, especially in ways that are consistent with Scripture. He's also interested in a range of topics, such as the strengths and flaws of different research methodologies, causality, morality, and decision-making. And he's really fun to talk to, because I sat with him at dinner yesterday. So maybe you should sit with him during lunch, and you would learn a lot of cool things. So take it away.
Thank you so much. I'm Sam. A little daunted by all the talents and intelligence in the room. I'm going to try and convince you that taking subjective well-being seriously will make for a better framework for impact and reveal new priorities where to allocate resources. And at the end, I'm going to give my Christian perspective. In real life, these two things are not separate, but I work for a secular company, so it's easier for me to cut it down at some point and say, this doesn't represent the views of my employer. So that's why. Faith is not just for Sundays, but in this case, I have to separate it. So I'm going to give you a little example. Say you have $7,500. You want to give it to a charity to do good, and you have different choices. You could give it to give directly and send cash transfers to double households' incomes. You could give it to the Against Malaria Foundation, which will distribute anti-malaria bed nets and save a life. Or you could give it to Strong Minds, which will provide group psychotherapy for 60 women in Uganda. And the question here is, well, what's the impact or the good of each of these interventions, and how can we compare them and make a decision about where to allocate resources? And maybe the example for you in your daily life will be different. You're a decision maker and you have to choose between where you're sending resources, or you have multiple programs and you have to decide which ones are the best. But the example of giving to charity is quite relevant to effective altruist donors who are like, where's my dollar going to make the most impact? And generally, when we start thinking about what's the good, what's the impact, what charities or groups report are how many people have we treated or how much income have we created. But these things are only instrumentally good. They're not intrinsically good. Why is it good for people to have money? Well, because it allows them to get things. Why is that good? Well, because, etc. And so if you ask yourself the question, why is that good far enough, you start thinking about what's ultimately good for humans, and you start thinking about what philosophers will call well-being. And there's a bunch of different theories of well-being. I'm not going to go into the detail here, but I'm going to focus on subjective well-being, so that involves the well-being of what's ultimately good for humans is within humans. And even if you don't think that well-being is the only thing that matters, I think you'd be quite convinced that people's happiness or people's satisfaction with their lives is quite relevant. So what matters isn't just that we're giving money to people or treating people, it's that we're improving their well-being. But then when you want to make decisions, you have to actually measure that. And there's a few different ways you can go about that. So one way is to think, well, what I care about is well-being. I'm going to take all these other measures I have, like income or the people I've treated. I'm going to make really educated guesses about how good these are for people's well-being. This is what GiveWell does, for example, by thinking, well, saving a life is worth this much, and doubling income is worth this much, and making kind of weights and values about what's morally relevant. And this is kind of like, if you have an index of multiple things and you don't have one particular thing that unites them, that's kind of what you'd be doing when you're thinking, well, my spiritual measure is worth this much, my income measure is worth this much. We're kind of making kind of guesses about what's morally relevant and how they relate to each other. And what I want to suggest is that if you're interested in well-being, is that you should actually measure well-being. And the most direct way you can do that is to get people to self-report their well-being. So if well-being is something inside of people, the only way you're going to get that information is by asking them, how satisfied are you with your life, or how happy are you with getting that information? So this is not just me saying, look at this incredible thing, you can measure well-being. This is something that social scientists have been doing for a while. The OECD has a bunch of recommendations and a lot of really good research about how to standardize these measures, and they have modules where they recommend different measures. So you have the question about a life satisfaction here. And when you look at well-being, you don't want to just think, oh, well, increases people well-being by 1 point. You want to think about how does it increase well-being over time. And if you combine time and well-being, you get well-being adjusted years. And the idea is that you take your intervention, the good it does to well-being over time, and that's your well-being. So a well-being is a 1 point increase on a well-being measure over a year. And this area in red, which is all the well-being that your intervention has provided, that's all the well-beings you've done. And on this graph, I've represented that you can produce well-being by improving lives, and you can produce well-being by extending lives. And I'll say a bit more about that. So again, well-being is not our thing. It's other people have proposed this method, but I think this is the way to measure things. But maybe we should just use educated guesses. Maybe it's cheaper or easier. But I'd like to make the case that humans are not very good at making educated guesses about what's morally relevant. Humans regularly fail at predicting how they'd feel in the future or how they'd feel in different situations. I think this paper has a really good example where they asked people to do time trade-offs. So they asked them, how many years would you be willing to sacrifice in order not to live with this or that condition? And when people are asked this, they think that having a small mobility problem is the same as having depression. But when you actually measure how people feel about having depression or a small mobility problem, if you go to their well-being, well, depression is 5 to 10 times worse. I'm just going to go with it. I'm really not a fan of health measures because they just involve people guessing how they would feel in different situations or how health would be in different situations. And so they don't capture how bad depression is for people. They're not capturing what's morally relevant here. So I'm all for using self-reports, but can we trust self-reports? Well, the first good thing about self-reports is that they don't depend on decision makers making educated guesses about what's relevant. If you're making guesses, you might miss out on something. So if you're only looking at income and health, you're not capturing the good of an intervention that is involved in improving relationships. You're not capturing something that's looking at, your social standing in society, or what's morally relevant about loneliness isn't that people have less income. It's something about relationships that's not measured if you're not measuring that. But if what you're doing is relevant to well-being and you're measuring well-being, then your measure it will be capturing that. As I was saying, this is not just us. The OECD have recommendations. Government organizations like the ONS in the UK measure well-being. And these measures have been statistically validated, so they're reliable. They don't just give you a random answer every time you use them. They're valid. They measure what they attempt to measure. I think a good example of the validity of these measures is the Gallup-Walpole data. So this is a map of the world and different countries' average life satisfaction. And you can see that countries that are less developed, have more public health problems, are less satisfied with their lives, so this seems to be capturing what we're interested in. And countries that are in crises like Venezuela or Afghanistan have really low levels of life satisfaction, which seems to measure, we're kind of getting at what we want to get here. So I've made my case that we should be concerned about well-being, and if we're concerned about well-being, we should be measuring it. And now, if we take this data, we can compare these different interventions, and that's what we've been doing at the Happier Lives Institute. So very briefly, we looked at many RCTs of interventions providing cash transfers or psychotherapy in low and middle income countries, looked at over 80 studies and ran meta-analyses on these, and used subjective well-being as an outcome. And what we tried to get is the effect on the individual over time, but also the effect on the household of spillovers. So if you treat someone for depression, that improves their well-being, but you also are probably improving the well-being of the household. And if you're not capturing that in your measure, you're not capturing some of the good involved. This is very, very neglected in terms of research. There's very little research on this, very little data. People seem to forget to measure this or make educated guesses about how good it would be. And then when you ask different people educated guesses about these. They give very different responses, so we should use data. And then we divide all this by the cost, so we get a measure of cost effectiveness. And very briefly, these are our results. Give directly and strong minds improve well-being in similar amounts, but delivering psychotherapy is much cheaper, so it makes strong minds much more cost-effective. Just to be clear, I'm not saying you should give psychotherapy to people who don't have depression. I'm saying you should give psychotherapy to people who have depression, who are probably also poor. But the idea is that having depression is not just always solved by giving people money. And if you give people money and you're in Uganda, you can't just go purchase psychotherapy. You need people to actually come and provide it. It's not just an available good like this. So strong minds, more cost effective than cash transfers. Next comparison is to the Against Malaria Foundation. We're going to kind of go quickly over some things that are a bit strange and difficult, but I think are important, is that here we're actually comparing an intervention that's primarily about saving lives and an intervention that's primarily about improving lives. I'll explain how we do it, and then I'll make the case for why this is important. The first thing is, in my graph with well-bees, it looked like I was saying, well, just take the years of lives you've saved times the well-being level, and that's the well-being you've created. But actually, there's a bunch of philosophical issues here, which is what's the badness of death, and where's the neutral point? Where's the point where you go from positive well-being to negative well-being? I'm not going to go into depth in these. If you want to have really long, strange conversations, come see me afterwards. But the idea is that if you answer these questions differently, you get different results. So here's the line for strong minds. This is the well-being, the cost effectiveness in terms of well-beings that strong minds produces. It's not affected by these questions because it's primarily about improving lives. But there's different versions of the cost effectiveness of the Against Malaria Foundation based on different answers to these questions. And you can see that in most of the cases, strong minds is more cost effective, unless you have a particular view about the badness of death and the neutral point is at a particular level. So these are difficult philosophical questions, and depending on your answer to those, the answer about which charities are most cost effective changes. This is difficult to do and difficult to explain as well, but I want to make clear this is not specific to well-being. So in healthcare, you're making decisions about, am I going to fund this, am I going to help people that have a lethal condition or non-lethal condition? If you're prioritizing programs in an organization, you are at some point probably going to make choices between a life-saving or a life-improving intervention. And if you want to make these comparisons, you have to answer some of these philosophical questions, implicitly or explicitly. So we don't take the Happier Lives Institute doesn't take a view. That's why we create an app where you can put in your views and see the different answers. But this will happen in some way or not. So DALYs, which is a health measure, used to be gradualist. Now they're deprivationist. I don't know. This might not mean anything to you, but like these health measures had implicitly in them a specific view of the badness of death, of how you value improving a life versus extending a life. And you might think, well, actually, maybe I just care about saving lives. But then how do you compare a program that saves lives and also improves part of those, like giving anti-malaria betanoids might also help people in other ways than just saving them, or this program might help people in different ways. So if you're just comparing the saving lives bit, you might be missing out on an improving life part of the intervention that you're not putting in your model. So that was the weird bit. What I want to say here is that this is just the beginning of our research. It's very probable that we might find a new and more cost-effective intervention. So key takeaways from the secular part of my job, which is we can measure what matters, well-being, and I recommend you do this with the best method, which is getting people to answer self-reports of well-being. And if there's only one thing you remember of today is like, please go to OECD recommendations and pick one of their questions and put it in your impact measures. Our research, I think, shows that when we do this, we get new important priorities. So improving mental health in low and middle-income countries is important and cost-effective, which is something you wouldn't get if you're just looking at income or health measures. And this is only the beginning. We want to do many more things. We've been looking at lead exposure, pain, and we're starting to look into childhood interventions. Yeah. And now I'm going to change gears and give a slight Christian perspective on this. These are not the views of my employer. They're very happy for me to be here. Maybe this is just because I'm French and there's like really strong separation. But I want to make the case that it's important that as Christians we think about how we're defining and measuring impact. Because as Christians we also have limited resources that we want to use and do good with. But we have our own views because we have a different goal, which is Christ's glory. Our goal isn't like just well-being or effective altruism or whatever the program our company is doing. We have a kind of ultimate goal, and we have an ultimate source of who defines what's good, which is God. So this means we need to do some thinking. One way is to just set out our own model, and that's just because of the way I'm working. This is not what I'm doing, and other people have more things to say about that. Otherwise, just to pick the best secular model. But I think it's worth thinking about how we can maybe take the secular model and tweak it, or think about how we might constrain it as Christians. And this involves a bunch of questions. One is picking the best model. So the best model is subjective well-being with cost effectiveness. This is my own personal view, but if this is our model, we need to think about what do we think is well-being? Is it the only thing that matters? What's our view about the badness of death? How do we distribute the good? So do we prioritize certain groups? Do we just take the total of everything? Do we equalize things? Does this allow us not only to compare life-improving, life-saving, life-making, but also soul-saving? That's a bit of maybe not the best words, but this is something we can ask ourselves, like, oh, wow, does this allow me to prioritize between mission and sending cash or things like that? And there's lots of different views about all of these, and I'm only going to talk about this one. So what is well-being? I showed you that there's a bunch of different theories. None of them is perfect. They all have bullets to bite. And I think you can have a Christian version of all of these theories, and Christians can legitimately disagree about what well-being is in this kind of these philosophical frameworks. But I think what Christians agree on is that perfect well-being is only for the new creation. So it's not in this time and place. So take desire theories, which is what's good, ultimately good for humans to have their desires satisfied. Well, the Christian version of this, yeah, ultimately what's good is to have our desires satisfied, but we want to align with what God desires for us. Perfect alignment with what God desires for us is only possible in the new creation, but I'm trying now, and I recognize that I'm a sinful, fallen creature that needs help. So I'm not giving an answer here, but as Christians we can think about what is well-being. I think God cares about our well-being. I think there's plenty of evidence that God cares about human well-being. But I think there's also evidence that we might care about things beyond well-being. So an example I like is if someone becomes a Christian in a country where they'd be persecuted, their kind of self-reporting of human well-being might well crumble, but we would still think they're better off. So this means we value something as a renewed relationship with their creator that we might not be able to capture in these measures. This becomes complicated once you start arguing that all of these are like actually about well-being and about perfect well-being in the new creation. But I still think these make a point for we might be valuing things outside of well-being, and that God also kind of probably directly gives value to things outside. Maybe he gives special value to life and to creation outside of human well-being. And so what we can do with this is continue thinking, building models, tweaking models, In the meantime, we just have to pick the best thing we can have. But also thinking about how I might constrain a model. So maybe I don't think well-being is the only thing that matters, but I like the way it's measured, and I think it's the best proxy I have. And maybe my constraint will be, well, if something says we're going to increase well-being and it goes directly against a command or a virtue that I value as a Christian, I might say, well, this is the point where these measures kind of break, and this is not necessarily an intervention that I want to fund. So, thank you very much. I hope I've convinced you that subjective well-being is important and that we should think about it as Christians.
Any questions? Yes, right here.
So, for context, I have depression, so I've taken these surveys so many times. And I get the sense in myself that like 1/3 of what I say numerically how I'm doing is like how I'm actually feeling, and like 2/3 is like ulterior motives. Like, I want you to prescribe me medication, I'm going to rate it lower. I've been going to therapy, I'm tired of talking about sad things, I'm going to rate it higher so you don't ask me follow-up questions. How do you distinguish like the actual signal from that noise?
Yeah. The first step is when we're still using the same kind of evidence for interventions that we're using RCTs, etc. So if you have a control group that's also depressed and they also want to get medication, they should be answering these measures in the same kind of biased way. So you wouldn't have the bias in there, or it would be kind of controlled out. Another thing is that this is just a good question to test and have like checks on this. This is something that will happen for every self-reported measure, not just well-being measures. We've started looking at this. So, for example, GiveWell said, "Oh, this is something we're really concerned about," and then they put a subjective discount on our numbers. And we're like, actually, there's some studies about this. Doesn't seem to show there's a massive difference. Maybe more research should be done. But again, there's research about like the validity, like the MAPO is showing about, well, when people use these subjective well-beings, does this correlate with stuff we expect it to correlate with? Which is the way you test validity in self-reported measures. It seems to be going well. Well-being measures are some of the self-reported measures that are the most tested because it's not only of interest to psychologists. I think that might be the reason that like, economists and policy people are interested in these as well. There's a lot of testing of these. So I think maybe more research should be done on how, like, when we implement these interventions, there might be demand effects on how people answer these questions. But overall, I'm kind of reassured that these measures have been statistically validated.
I see. Thanks. Yeah. Other questions? Back there.
I'm fairly new with these measures, but when you talk about well-being, is it your own well-being? Or is it also the well-being of others relative to yourself? And the reason why I say that is because the model that one of the measures that I follow up and that we evaluate in the LAC programs in Latin America is how my empowerment is used not just to improve my life, but to improve the life of others. So how we go from empowerment to service. So I'm just curious about if there's anything in those well-being metrics that take into account you projecting that and looking at you affecting that.
So in a sense, if for example your metric is how satisfied you are with your life, your satisfaction with your life might be determined by how well your family is doing, and that will be captured in that measure. But when we're thinking about, okay, the well-being of everyone in this family or everyone in this community, you want to actually be measuring everyone there, or a sample of everyone, so that you can actually get people, like the numbers of everyone, and collect them together, not just ask the person you're giving an intervention to, how satisfied are you with your life, and how much do you think this other person in your family is satisfied with their life? Because I was saying people are not very good at making guesses, and then there might be, it's possible there might be factors that influence how you answer for someone else. So if you're depressed and you're evaluating the well-being of your child, and then you're no longer depressed, maybe the way you evaluate things have changed for someone else. So it's about actually capturing it for every individual and then putting that together in the model. Does that answer your question?
Right there.
Are you aware of any findings on the impact of soul saving on subjective well-being?
That is something I haven't looked at. And then there's a question about can you actually measure soul saving?
Like people say, like, before I wasn't saved, now I'm saved. Like, do you actually see a change in the report of subjective well-being?
Yes. So I haven't looked at like anything like pre-post, but religion has a massive positive effect on well-being.
Like association.
Yeah. Relationship well-being.
We're going to use the econ definition of
Lincoln
college.
not here anymore, but you can tell us what the odds are. So.
But
we have some on this as well. No, continue. But
the question there is usually when secular people measure religion, they're like, oh, tick this box, and then they're not like which religion, which doctrine, which thing, and then there's questions of maybe it's just because it's maybe not because of something deeply spiritual, but that you have really great relationships, things like that. But maybe other people like James could say more about that.
Okay. So I've been having a little bit of a debate about religion or spirituality and well-being. So a lot of well-being measures, might have different sub-constructs. It could be financial, emotional, health. Is it, in your opinion, do you think it's appropriate to add spirituality to a well-being index? Or do you believe spirituality is a driver of well-being?
So if you use an index with multiple questions, then you have a question for yourself as a decision maker about, well, if my intervention moves one needle or another needle in different ways, how do I value this? So this is why life satisfaction indices have a general how satisfied are you with your life question first, and then the sub bits. And so you're making your decision based on the general one, and then you're looking at the sub bits to see what might be the drivers of how your intervention is affecting the general life satisfaction. So if you then add a spiritual well-being question in, the question is this, are you putting it as a driver, or are you putting it as an outcome, and how are you valuing these things? I don't have an opinion because I work in the secular realm. It's just like get the life satisfaction question, and please, if you put subjective well-being questions, put the general one, not just a bunch of indices and then making a mean. Put the general one in there. Sorry if I don't have. So then the question is, which one are you going to value?
Yeah. What tool do you use?
We use whatever people have. We do like secondary analysis. We use whatever people have researched, and then sometimes cry a little bit. This is not a cost-effective way of going to the back of. But if I had to make recommendations, I say go to the OECD. The OECD have a 200-page document about subjective well-being. But if you scroll at the bottom, they have an appendix with like modules of core questions and modules for specific theories of well-being. If you don't like life satisfaction and you like happiness, you can pick a module for that. This one has all of the subjective well-being theories in there: life satisfaction, eudaimonia, hedonia. So I recommend just follow what the OECD say, because they've done lots of good research. They're trying to standardize government research, and they're going to have an update at some point.
Yeah, I really appreciated that you put the persecution example on there, which is a hard one and a good one to think about. And I wanted to push a little harder on that theme, because I think a lot of times when people reflect on their spiritual lives, it's very common for people to say that they feel like it was in times of pain or of suffering in some form that they feel they've really formed in important ways or changed in important ways or be closer to God. I'm sort of curious how you think about that. And, one view is that like if we ask the question the right way, people will say that was, in some sense, a satisfying and difficult time of life, so it's already in here. Or another view is that we need two dimensions to really capture that.
So
suffering information.
Yeah, I'm not aware of people who have gone to Afghanistan and asked people who've become Christians like how satisfying.
I'm not saying that. I'm saying the routine parent guys where you take on too much stress at work and at some point you realize that your values are out of line and you need to step back and reconsider. There are lots of hard experiences people have in life which are not because I became a Christian I was persecuted. It's more like because I hit some kind of a wall I realized I need to think harder about my relationship with God.
In the sense that, going down in well-being might be a good thing in the long run. Is that?
Yeah, well, a good in a sort of spiritual dimension. Sort of, exactly that process you talked about of sort of, over time coming to right order our loves. We love things in the same priority order God loves them. Sometimes we have to hit painful experiences to teach us that there was reordering that was needed.
Yeah. So I think if that's not captured in the subjective well-being measures, then that's kind of further evidence that when we're thinking about spiritual outcomes, we're valuing something on top of or external to human well-being. But if it happens that it's there's this dip and then it goes back up because you've realigned and that seems to also increase your subjective well-being, then this is about not just measuring just 1 or 2 points, but about measuring over time. You can make the same point with maybe you come down on income, and then you revalue your life, and then your income goes back up. You'd want to measure multiple points. Yeah, I think that's a very good example of where we might actually split with a kind of purely welfarist approach.
Good. Sam, love it. You know that I love this because we geeked out last week at the London conference together. And shameless plug for later, I'm going to steal all the sound points and pick them up in my call. But question, to get to the answers of a lot of these questions, which I believe we're going to get to in the next few years, and as you know, if we don't, the secular world will, i.e. McKinsey, Harvard, etc., because they realize that spirituality is a part of well-being. But to do that, there's been a huge amount of work to get to these questions, correct? Right?
Yeah.
So, could you comment maybe on sort of almost the amount of work it takes to get to, an OECD paper where we can just go, this is life satisfaction, and what that might look like in a spiritual context?
You get to a 200-page thing, so there's a lot of stuff there. So I think spiritual well-being.
How long has it taken to get to okay, these are the 5 questions on life satisfaction?
I don't know how long it took them to do this report, but I know that now we're in 2023 and they're thinking of doing an update, and it's still ongoing. And they've been working from that point on, looking at what people have been measuring, has it been going, things like that. So I think there's a lot of work, there's a lot of research. Social science is quite young. How do we measure things inside of humans? And also it had the dark moment of behavioralism, which was we can't measure anything inside humans, so that took a bunch of years out of the process. So these questions are some of the most tested questions, and it took decades maybe to. But we can piggyback on some of the research, which now people are thinking about validity, reliability, or people have tested some questions like what endpoint should use, how long should your scale be? So use 0 to 10. Don't do 3 points and ask unhappy, neutral, happy. Please use more points. But these things have been answered, so that's something you would have to work on. Again, the question and this is something James knows. Yeah, go to his talk for it. But for the spiritual welfare, how are we going to value this as Christians? Are we going to put it as on top, or as a driver, or how are we going to do trade-offs between it? If one program doesn't increase spiritual welfare, but increases all the other measures by 10 points, like should we do that one? So I think there's more research, but there's also more capacity, more people working on this. There's organizations like the Gallup World Poll that using animations has limitations. Like, this is something we can have now, like where people go and survey almost all the countries. So there's material to use and more things. And if you're a Christian organization that has capacity to run surveys, and you start putting in these questions, or talking to James and putting in whatever questions he might want you to put in, then you can push this forward.
Can I add a quick thought to exactly what you just said? So we used the first question that you had on that slide earlier, except we asked instead of in the most recent, it said like recently or something on yours, we used in the last 3 months.
Over all these days.
Yeah. We also asked a question where we asked people their religion, just directly. And we've recently, in a couple places where we look, had like enough people switch their religion from baseline to inline to Christianity that I was able to use life satisfaction as an outcome and, regress multiple things. A regression that would probably be shameful to present to some of the academics in here. But it was, ultimately I was able to use as one dummy variable whether or not they had changed their religion to Christianity, and that was the case for more than 10% of the population. So it was a useful dummy variable. It was very positive. Like the effect of people becoming Christians had a positive effect on the outcome of their answer to that first question. Very interestingly, there was an even stronger effect when I also included interaction terms with whether their outcomes had improved in other areas. So the effect of improved food security or improved economic outcomes on a Christian convert was much more positive than the effect of improved food security or economic outcomes on an individual who is not a Christian convert.
That's really cool.
Our survey data sample size was not as large as I would like. This is like a 500 household survey, but it was really cool to see that. I wish that was a question.
That's exciting. It's exciting.
My question is probably if I showed it to all of you, how you could make it better analysis. But we can talk about that later. And I was just told we should wrap up.
That's great. We have the next session starting in 5 minutes, and let's give Samuel.